the statistical value of a 20 to 40-year-old's life is different to the value of a 70-year-old's life from the point of view of an economist. So it's essentially an extremely pragmatic view, I suppose.
It's a very pragmatic view. Be prepared.
Feel free to disagree.
So what about we hear the interview? Dr. Mark Halloran in conversation with Professor Gigi Foster.
Professor Foster, thanks very much for agreeing to the interview. You've become almost infamous, I suppose, for a panel that you participated in for a Q&A, where you stated that the lockdowns for COVID-19 and the closure of international borders were a mistake and led to greater deaths. And I thought that economists tend to think of life differently to other people. You know, you spoke about statistical lives and quality-adjusted life years. I just wanted you to expand on what you meant by that.
Sure. So in economics, we typically make many decisions in normal times that require us to have a currency in which to value human welfare. And these situations arise because resources are scarce, and we have to choose, even though it's heart-wrenching to do so, how to allocate those scarce resources across competing priorities, many of which do involve human welfare. So a couple of currencies that are in common use are the value of a statistical life and the quality-adjusted life year. The first of these, the value of a statistical life, is used often in environmental regulation setting and sometimes in traffic and infrastructure decisions where we need to make a decision. Let's say in traffic, we need to decide what is the speed limit going to be on this road. And we know that setting any given speed limit is going to produce some level of deaths. We could have speed limits of 1 kilometer per hour on all of our roads, but that's just not something that people would accept. Right? So yes, we are willing to accept some level of deaths in return for the benefit of having reasonably efficient transport. And so when we make those decisions, we take into account the value of a statistical life, which is usually set to be somewhere between $4 and $10 million. And that figure comes actually from real people's choices in terms of, for example, the premia that they pay for life insurance policies, or how much extra they ask for in their wages in order to take on a job which has an additional amount of danger, like window cleaners really high up on a skyscraper or being a stuntman. These sorts of jobs have additional danger embedded in them, which means an additional risk of death for every year that you perform that job. So from figuring out how much people are willing to pay for taking on that risk, we can work out what their sort of implicit value of their own life is. And so the value of a statistical life comes from that empirical evidence in terms of people's choices. So that's one currency. The second currency is the quality-adjusted life year. And this is one which is used often in medical decision-making, health economics. And essentially, it's a year type of currency rather than a life type of currency. So it enables you to value, for example, the remaining life left of a 20-year-old differently than the remaining life left of an 80-year-old. And a perfect quality year would have this value of 1. And then when you go down, further from that, so you have pain or suffering, you have disablement, then there's a lower value. And again, based on the decisions people actually make, we can put a value on that quality adjusted life year. And typically that's somewhere around $50,000 to $150,000. So those are the currencies that are in most common use in normal times when we're making policy decisions in health economics or in other kinds of policy arenas, including outside economics and engineering and other risky sorts of decision-making. So basically, when I look at the COVID-19 crisis, my thought is, well, what are the costs and benefits of the policies that we have on the table as options? And let's denominate those in terms of one of these standard currencies. And of course, it's not just lives saved or quality-adjusted life years saved that could have otherwise been taken by COVID-19 or its after effects or its symptoms, but also all of the other lives saved and quality adjusted life years saved from not implementing certain kinds of restrictions such as the lockdown. So the lockdown and many of the other policies that we've seen around the world, not just in Australia, have carried costs that can be denominated in the same currency, that is human welfare, lives and quality adjusted life years, as we look at in those tables and graphs of COVID-19 deaths.
Well, in terms of COVID-19 and the modelling, when we're looking at a critical fatality rate of, it's varied somewhere between 0.66 to 1.4%, including asymptomatic cases. And the projections here are around sort of letting it go, not having the strict lockdowns, keeping international borders open, with somewhere between 50 to 150,000 deaths. That's very concrete. In terms of hypothetical models, though, when you're trying to calculate the effect of a life for a life in terms of the effect of the lockdown itself, in terms of lives, are you able to make the same projections?
Well, I would first quibble with the notion that somehow that number that you just cited, or set of numbers, 100,
Yes.
150,000 was the max, is actually, concrete in the sense of being certain. It is itself the output of a model. It is not something that has been observed. Indeed, that never came to pass. And in fact, if we look around the world now, the countries in which this thing is hit worst, if you take their per capita death rates and apply them to Australia, we would not have, even under any policy setting that has been seen around the world, we would not have had more than 20,000 deaths. So those initial models, which is what they were, models, not empirical data, but models, they were out by an order of magnitude. And the modeling that would be required to be brought to the table together with the epidemiological models is more of a holistic, whole of society type model of the types of consequences of the radical economic policy settings that we were considering at the time. And my concern is that really there was only one camp driving the policy decisions, and that was the epidemiological camp. And I believe that that narrow focus was mainly a function of fear, of hysteria. People were locked onto this COVID-19 thing and they just could not see anything else.
I didn't mean concrete in the terms of that it's empirically proven. I meant that it was a model that was able to offer a death rate. And when I'm listening to what you're saying, I don't hear the model that's offering a comparable death rate to, which may not be possible in terms of, if you think about the economic effect we're facing, the first recession that we've had in 29 years, and in the March quarter, the GDP shrank by about 0.3%. What are the ramifications on the public health system going into the future? What are the ramifications for the entire country from that?
Yeah, no, absolutely. And you're right that those models giving death projections from COVID-19 are easy to understand, and they produce these specific numbers because they are so narrow. Because they are only focusing on one aspect of what is a very complex phenomenon, which is our social and economic lives, right? And so when you start to consider policies that would take your GDP down by, a point, 2 points, 3 points, 10 points, which is what, projections have been looking like for the middle quarter of this year, that is implying that you're reducing not just the capacity of individuals to spend, but the capacity of governments to spend on things that promote human welfare in Australia and worldwide. And that's really the main, component of the costs that are being paid by this lockdown policy. Is we are essentially just we're regressing back to a lower GDP per capita state. And the reason this is important is because even in developed countries, it's not that somehow, we arrived here by some good fortune and, loving our environment and, giving more attention to our children than other people or some sort of, cultural thing. It's that GDP per capita, much as people don't like to think about it, but it's because it feels hard and monetary. But that GDP per capita is what has allowed us to invest in infrastructure, in education, in healthcare, in research and development across the span of different industries. And that's delivered for us the quality of life that we have now and the ability to even do what we have done in the context of this virus, which is have this massive national coordination, have, health systems ready to receive and able to, staff those health systems with well-educated doctors and nurses and, organized police and other enforcement mechanisms. This is all the fruit of high GDP per capita living. And when we decrease that, then that means there's going to be that much less government expenditure going forward for not just this year, but in future years on everything that I just talked about, which all feeds into human welfare. So if you believe you can actually tally up the decrease in human welfare that would come about via that decrease in GDP per capita, including government expenditure as well as private expenditure, of course, then you can get a currency, again, figure that you can compare against the figure of, COVID-19 deaths averted and suffering averted.